Hi, my name is Holly, and I'm one of the marketing directors with Randall Mill Pharmacy.
And I'm Patrick. I'm the pharmacy manager at Randall Mill Pharmacy.
And today we're going to be discussing a topic that may be easily looked over when one is provided education surrounding their diabetes, such as how to manage your diabetes when you're sick. Okay, so when I am sick, should I change how often I check my blood sugar?
Yeah, so just remember the phrase 2 to 4, the number 2 to the number 4. For patients that have type 1 diabetes or are currently using insulin, you want to check your blood sugar every 2 to 4 hours while you're sick. Or for patients that are not currently using insulin, you would check your blood sugar 2 to 4 times a day to make sure that you're still within your goal range.
Okay, good to know. Another question is should I check for ketones? Is that an issue?
Yeah, so for our diabetic patients, I'm sure you're familiar with ketones, and that's definitely a sign of a very serious issue going on. If you're a type 1 diabetic, or if you check your blood sugar regularly while you're sick and you notice that your level is above 250 for longer than 4 hours, then yes, you definitely want to check your ketones. Another sign that you may have ketones or producing ketones would be diarrhea, vomiting, and then one that's not really seen anywhere else but is pretty specific to ketones would be a fruit-smelling breath or fruity flavor, on your breath.
Okay, Patrick, another question I have is, should I continue to take my diabetes medicines while I'm sick?
Okay, and the answer is yes, with a caveat. So you want to continue to take your medicine, but just like we talked about earlier, you want to make sure you're checking your blood sugar to make sure that your readings are in the correct level and where they're supposed to be. So obviously if you take your blood sugar and it's low, you wouldn't then want to use insulin on top of that. Monitor your blood sugar, and of course it never hurts to talk to your doctor, talk to your pharmacist about when to use insulin, how to manage your sickness, and when to use your medicine. For people that are taking tablets, you definitely still want to continue to take it. Now that may be affected a little by how much you eat. If you're vomiting, you want to wait until you can keep that tablet down. But yes, overall, do continue to take your medicine. Just monitor your glucose readings and talk to your doctor or pharmacist about it.
Okay. Can you provide me with some information on what I should eat or drink while I'm sick?
Sure, yeah. So keeping in mind, we're still checking our blood sugar readings and making sure we're in range. You will then base what you eat off of what your reading is. Mm-hmm. So if you take your reading and it's low, then you would still treat it as you would any other time your blood sugar was low. You would want to take some glucose tablets, maybe drink half a cup of fruit juice or half of a soda, eat some pudding or some Jell-O that has some sugar in it, something like that. On the flip side of that, if your reading is high, then you want to eat sugar-free items to help your body lower that blood sugar. So now we're talking about sugar-free Jell-O, sugar-free pudding. We may be talking about diet soda, things along those lines, things that are beneficial for a diabetic diet or that are just sugar-free altogether.
Okay, good to know. Okay, Patrick, it's inevitable that everyone gets sick, right? Mm-hmm. So what are some things that you feel that I can do to prepare or stock up to keep around the house to prepare for whenever we do get sick?
Sure. Some good items to have on hand ahead of time before you get sick would be something like milk of magnesia. We also have anti-diarrheal products. Imodium is the brand name there. Tylenol, Advil, Tums is another good one just to keep on hand. Remember a thermometer as well. You always want to know what your fever is if you have a fever. Some food products that would be good to keep on hand would be something like glucose tablets here, sports drinks and soup, crackers and Jell-O, among other things that we've talked about previously in this video.
Okay. So, in someone with diabetes, can you just wrap up with just a few simple key points that someone could just follow, kind of keep in their back of their mind at all times if they become sick?
Sure, yeah. So remember, you do not want to stop taking your medicine unless your doctor tells you to. You want to weigh yourself daily to make sure that you're not losing weight. If you're losing weight, it can be a sign that your blood sugar is too high. You also want to take your blood sugar at least every 4 hours, and you want to drink extra liquids. Now again, the sugar content depends on what your blood sugar level is when you take your reading, but you want to stay hydrated, especially if you're vomiting or if you have diarrhea, because you can become dehydrated very quickly in those instances. So make sure you're staying well hydrated. And then lastly, you want to make sure you're checking your temperature every day while you're sick, just to monitor that as well.
Okay, great. Patrick, that's some great advice for anyone with diabetes on how to manage their sick days.
And remember, if you have any questions, you can always call me. My name is Patrick again, and the number at the pharmacy is 817-274-1883. I'll always be available for questions.
Okay, and if you would like any more information regarding anything that we talked about in this video, we're going to post a link directly to the CDC down below that provides you with more information surrounding how to manage your diabetes while you're sick. Also, please remember to like and share this video, and also subscribe to our YouTube channel. You can also find Randall Mill Pharmacy on Facebook as well as Instagram. Thank you for watching our video, and we'll see you next month.